What if the difference between life and death wasn't your condition, but your country? From a system invented in 1883 to robot caregivers serving an aging population, these are the 10 nations that cracked the code on healthcare. Ranking healthcare systems is controversial. There's no single perfect measure. So we combined the World Health Organization's landmark ranking of 191 countries with the Healthcare Access and Quality Index from the Lancet, one of the world's most respected medical journals. We also cross-referenced life expectancy data, spending efficiency, and patient outcomes from the OECD. Every country on this list has universal coverage, but how they achieve it, that's where it gets fascinating. At number 10, Australia. In 1984, Australia launched Medicare, a tax-funded system covering every citizen through a simple 2% levy on taxable income. But here's what makes Australia truly unique: the Royal Flying Doctor Service, one of the world's largest aeromedical organizations, operating 79 aircraft from 23 bases across 7.7 million square kilometers of outback. That's an area larger than the entire European Union, served by flying hospitals. In 2023 alone, they performed over 4,800 emergency evacuations, ran 3,800 primary health clinics, and delivered 36,000 dental services to remote communities. Australia proves that geography doesn't have to be a barrier to world-class healthcare. Quick tip: if you're visiting Australia and need emergency care, dial 000. Even as a tourist, public hospitals must treat you in an emergency. You'll get a bill later, but they won't turn you away. Number 9, South Korea. What South Korea accomplished is historically unprecedented. In 1977, the country had zero universal healthcare coverage. By 1989, just 12 years later, every single citizen was covered. It's the fastest universal healthcare rollout in history. But Korea isn't resting on that achievement. The government has committed 900 billion won, roughly $670 million, to next-generation medical technology, with AI diagnostics leading the charge. At Seoul National University Hospital, artificial intelligence now assists radiologists in detecting lung and breast cancer from scans, catching patterns that human eyes might miss. South Korea's healthcare AI market is projected to grow from $150 million to $1.3 billion by 2033. Number 8, Switzerland. Here's something most people don't know. Switzerland has no public healthcare system. None. Instead, every resident is legally required to purchase health insurance from one of about 50 competing private companies. But here's the twist: those insurers cannot refuse anyone, and they cannot make a profit on basic coverage. It's called the LA-MAL system, introduced in 1996. Premiums aren't based on income, they're flat, community-rated. The average Swiss adult pays around $500 per month, making it the most expensive system in the OECD. Yet Switzerland scores the highest healthcare access and quality index of any country on this list, 91.8 out of 100. Here's the thing most people miss about Switzerland: you can switch your insurer every single year, no questions asked, regardless of any health conditions. That deadline is November 30th for a January 1st change. Number 7, Sweden. Sweden's approach is radically decentralized. The country is divided into 21 regional councils, each with the power to levy their own income taxes and run their own healthcare systems independently. That means healthcare in Stockholm can look very different from healthcare in rural Norrland. 86% of the system is publicly funded, the third highest rate in the European Union. And here's what makes Sweden truly patient-friendly: there's an annual cost cap. Once you've spent about $120 on outpatient visits in a year, every additional visit is completely free. Prescription drugs have a similar cap at roughly $260. After that, free for the rest of the year. Number 6, the United Kingdom. On July 5, 1948, something revolutionary happened. The National Health Service, the NHS, opened its doors. For the first time in Western history, an entire nation's population could see a doctor, have surgery, or receive emergency care completely free. No insurance card, no copay, no bill, just healthcare funded through general taxation. 77 years later, that founding principle still holds. The NHS covers everything from GP visits to cancer treatment to maternity care, all free at the point of use. But the system is under enormous strain. Over 7 million patients are currently on waiting lists, and that tension between the promise of universal free care and the reality of limited resources, that's the challenge every publicly funded system eventually faces. If you're visiting England and need a doctor, walk-in urgent care centers will see you for free, even as a tourist. Scotland, Wales, and Northern Ireland don't even charge for prescriptions. Number 5, Germany. Every healthcare system in the modern world owes something to this country. In 1883, Chancellor Otto von Bismarck signed the Health Insurance Act, creating the world's first social health insurance system. 142 years later, Germany's system still runs on that same principle, solidarity. Premiums are based on income, not health risk. Employers and employees each contribute about 7.3% of gross wages to their chosen sickness fund. And yes, you choose. Germany has 96 competing nonprofit sickness funds, down from over 1,800 in 1970. Patients can freely choose their fund, their doctor, and their hospital. Family members? Covered free of charge. Roughly 16 million people insured at no additional cost. Number 4, Japan. The numbers tell a remarkable story. Japan has the highest life expectancy on the planet, 84.8 years, yet only 2.7 doctors per thousand people. That's well below the OECD average. How? Japan's mandatory health insurance system, universal since 1961, keeps costs low by setting nationwide fee schedules. The same procedure costs the same whether you're in Tokyo or a rural village. But Japan faces a crisis no other country has confronted at this scale. Nearly 29% of the population is over 65, the highest proportion in the world, projected to reach 40% by 2060. The solution? Robots. The Japanese government has invested over $300 million in eldercare robotics. 330-pound humanoid caregivers now assist in nursing homes, lifting patients, guiding exercises, and providing companionship. Something that surprised me about Japan, the average Japanese person visits a doctor over 12 times per year. That's more than double the OECD average. Access is so easy that checkups are practically a cultural habit. Number 3, Singapore. Singapore might be the most efficient healthcare system ever designed. While most countries on this list spend 9 to 12% of their GDP on healthcare, Singapore spends just 5.6% and achieves a life expectancy of 83.9 years. How? The 3M system. Pillar 1, MediSave. Every working citizen contributes 8 to 10% of their salary into a mandatory medical savings account. It's your money, earmarked for your health. Pillar 2, MediShield Life. Universal catastrophic illness insurance, covering every citizen automatically, with premiums drawn from your MediSave account. Pillar 3, MediFund. A government endowment fund that acts as the payer of last resort, so no one falls through the cracks. On top of that, public hospitals receive government subsidies of up to 80%. The result? Singapore spends less than half of what most Western nations spend and gets better outcomes. Number 2, Italy. Italy's position might surprise you until you look at the data. Ranked number 2 by the World Health Organization, Italy achieves a life expectancy of 83.9 years while spending just 9% of GDP, well below the European average. The secret? 2 things. First, the Servizio Sanitario Nazionale, the SSN, established in 1978. It's a tax-funded system administered by 19 regions and 2 autonomous provinces, creating essentially 21 separate healthcare systems under one national framework. Second, and this is what researchers keep coming back to, the Mediterranean lifestyle. Diet, social connection, outdoor living. Italy proves that healthcare isn't just about hospitals and doctors. It's about how a society lives. In 2025, Italy introduced a landmark reform, a unified national tariff system where the same medical exam costs the same from Milan to Palermo for the first time in decades. Here's something most travelers don't realize. If you're an EU citizen, your European health insurance card gives you full access to Italy's public health care. Same treatment, same cost as locals. And at number 1, France. When the World Health Organization ranked 191 countries, France came out on top. And 26 years later, the reasons still hold up. France's system is built on a simple but powerful idea, the carte vitale. This green smart card, carried by over 60 million people, stores your insurance information, your designated doctor, and your coverage details. Walk into any doctor's office or pharmacy, present your card, and the system handles the rest. Social Security reimburses approximately 70% of costs, and 95% of French residents carry supplementary insurance called a mutuelle to cover the remaining 30%. The result is a system where virtually no one faces a medical bill they can't afford. France achieves a life expectancy of 83.5 years, with 3.3 doctors per thousand, spending 12% of GDP. But what earned the top ranking wasn't any single metric. It was the balance. Access, quality, responsiveness, and fairness. France scored highest when all 4 dimensions were weighed together. In November 2025, France began rolling out a digital version of the carte vitale on smartphones, modernizing the system that's been the gold standard for over 2 decades. 10 countries, 10 completely different approaches, but they all share one thing: the belief that healthcare is a right, not a privilege. From Germany's 1883 blueprint to South Korea's 12-year sprint to Singapore's radical efficiency, the best healthcare systems prove there's no single path to keeping a nation healthy. If you found this eye-opening, subscribe and hit the bell so you never miss a ranking. Like this video if you learned something new about a country's healthcare. And leave a comment. Which of these 10 systems would you most want to live under? Let us know below.